I'm Dr. Guanche, and I'm a hip arthroscopy specialist at the Southern California Orthopedic Institute with over 20 years of experience. I'm one of only a few physicians around the country that does complex hip arthroscopic procedures, including labral repairs, femoral neck resections, bursectomies, abductor repairs, and hamstring tendon repairs. In this video, I will be discussing hamstring tendon repairs. Hamstring tendon injuries occur with a lot of quick reactive motions. The most common type of scenario includes a water skier that gets pulled, people falling and doing the splits, or in some situations we'll see sprinters or fast running injuries that occur. The hamstring tendon complex is made up of three different muscles that cross both the ischium, which is traditionally known as the butt bone, and across the knee. So it's a very important muscle complex that really stabilizes most of your pelvis and allows people to run and be very active. In situations where a tear occurs, most people that are not highly active can really tolerate the problem pretty well. In the more active patients, often we'll have to do a repair. The most common symptoms and signs of an injured hamstring are acute pain around the back into the buttocks area. Oftentimes patients will notice a very large amount of bruising that happens 3 to 4 days after the injury. Oftentimes patients will come in and complain of giving out of their leg and they're worried about a knee injury when in fact it's actually the hamstring that's injured. Most hamstring injuries can be treated with a combination of activity limitations as well as icing and the usual modalities and stretching that we do for most other muscle injuries. Oftentimes, a course of physical therapy is indicated if a significant tear is found. In many situations, if there's a question as to the size of the tear, an MRI of the hip will be obtained, and that will look at the area of the hamstring and determine how much of the muscle is actually injured. Once patients go through the course of physical therapy, activity modifications, and if in 6 to 8 weeks they're still having a lot of trouble, the situation becomes a surgical option. Those are the patients that usually require surgical intervention. The most common intervention traditionally has been through a big open approach, which has required a period of hospitalization and significant trauma to the soft tissues in trying to do the repair. More recently, we can do the procedure through very limited incisions, 5 to 6 millimeters, multiple little incisions, and we can do the patient as an outpatient so that they can go home and continue on with their day-to-day activities with a minimal intervention in their life. The typical recovery process following a hamstring repair includes a period of using a brace which holds your knee at 90 degrees to try to relax some of the area of the muscle and protect the repair. Most patients are able to get around on crutches for those first 4 weeks. We typically do not start physical therapy till at least 4 weeks postoperatively as a result of the need for the hamstring to start to repair before we can actually stress the tissues. Following the period of brace usage for at least 4 weeks, patients are then started in physical therapy. Most often, patients will complain of a fair amount of stiffness around the knee, and the physical therapist will work on that aspect. Once the knee motion returns, we're able to start weight bearing more effectively. Patients will start riding a bicycle within the first 6 weeks. Following that, at about 2 months postoperatively, that's when patients start doing a little bit of more traditional walking, a little bit of hiking, and then typically by about 3 months we're able to return patients to a little bit higher level and start thinking about running and returning to more explosive sports. The treatment of hamstring injuries traditionally has been limited to very large tears in very high-level athletes. With the way that we're doing it these days with the very limited interventions and the endoscopic techniques, we're able to treat a lot more of the average athletes and really return most of these patients back to their usual activity level very, very quickly. To learn more about hamstring repairs, please visit our website at www.scoi.com. Thank you.